Today, I will place multiple implants using Osstem new digital guide surgery system called OneGuide. And immediate loading will be done. Before I start, I will briefly explain the surgery plan. The patient is a 52 years old male with no significant medical history. Several maxillary and mandibular posterior teeth were extracted about 4 to 6 months ago in other dental clinic. So the left upper canine was extracted about 6 weeks ago in my clinic. This is a pre-op photo. This is a lateral view. There are sufficient vertical dimensions for restoration. Shown in this slide is the occlusal view of maxilla. Healing of the soft tissue on the extraction side looks promising. A resin wire splinted provisional prosthesis was used in right upper lateral incisor, but I have removed this provisional prosthesis to place implant in this side. These are pre-op CT scans of right side. In the molar area, residual bone height is sufficient, more than 10 millimeter. But the bone quality is expected to be poor. So in order to get good initial stability of molar implant for immediate loading, I will place implant to engage the sinus floor. As you see in the right upper post premolar CT scan, there is some palatal bone defect. So GBR using the Oss builder preformed in 3 dimension and customized titanium mesh will be done after implant placement. These are pre-op CT scans of right side, left side. Left upper post molar area has 5 to 6 millimeter of residual bone height to the sinus floor. So I think that this is a very good case to show off using OneGuide system and CAS kit simultaneously for easy and safe multiple implant placement after crestal approach sinus lifting. As shown in this slide, there is a sinus septum in the left second molar area. By engaging the implant to the septum, we can increase the implant primary stability. However, it is very difficult or sometimes impossible to find the exact location to engage the implant to the sinus septum. But by using the digital surgical guided template, we can place implant right on the septum. So today, I will engage the left second molar implant in the septum. And to make the implant placement plan, we merged the COMBEAM CT data and the surface scan data. Surface scan data were collected by model scanning. This is a crown arrangement of the maxilla on the implant planning program. As Dr. Ki-Sung-Kim said, 3Shape Implant Studio was used to make a OneGuide surgical template. This is a crown arrangement of mandible. Because of limited time, I will show you the placement of 10 implants in the maxilla during the live surgery. And after the live surgery, I will place 6 more implants in the mandible with OneGuide system. Lateral view of the crown arrangement. Let's see the implant placement plan in each side. In the right upper lateral incisor, a 3.5 by 11.5 millimeter TS3 implant will be placed. In the right second molar, 5.0 by 10 millimeter TS3 implant was planned. In the right first molar, 5.0 by 10 millimeter, same as the second molar area. As I said before, I will engage the sinus floor to get enough initial stability for immediate loading. In the right second premolar, 4.0 by 8.5 millimeter was planned. In the right first premolar, 4.0 by 11.5 millimeter TS3 will be placed. As you can see, there is some palatal bone defect. So GBR with the Oss builder will be done after implant placement to cover the exposed palatal side implant. In the left upper canine, 4.0 by 11.5 millimeter implant is planned. Left upper post premolar, 4.0 by 11.5. In the left upper second premolar, 4.0 by 10 millimeter implant will be placed. Because of the palatal bone defect, GBR with Oss builder will be used. GBR with Oss builder will be done after implant placement, just like on right post premolar implant. Let's see the left upper post molar implant placement plan. I will not place an implant like this. With the consideration of potential sinus membrane perforation, the surgical guide was fabricated to intentionally leave a margin of 1.5 millimeter below the sinus floor when placing 7.0 millimeter length implant. By doing so, the surgical template works as a stopper, just like a cast stopper during drilling with 7.0 millimeter length OneGuide drill. Because in this area, the residual alveolar bone height to the sinus floor was about 5 to 6 millimeter. Since bone quality is expected to be soft, 4.5 diameter OneGuide drill will be the final drill to perform undersized drilling. After removing the surgical template, the cast drill will be used to penetrate the sinus floor, and then the sinus membrane will be lifted with hydraulic lifting. Then 5.0 diameter fixture will be installed. In the second molar area, the residual alveolar bone height, the mesial side, is quite limited because of the inclined sinus floor. So the second molar implant placement plan was made to have a 1.5 millimeter margin below the sinus floor when placing 7.0 millimeter length fixture, just like the first molar implant. The second molar implant will be placed after sinus lifting with a casket. By engaging the septum in the distal area, the primary stability will be increased. This is a OneGuide surgical template design. Surgical template will be fixed with 3 anchor pins in the palatal side. To summarize, 8 implants will be placed with the OneGuide surgical template. After removing the surgical template, crestal approach sinus lifting using the casket will be done in the left side, and 2 more implants will be placed on the left molar area. And then palatal bone augmentation with os builder will be done in the right first premolar and left second premolar implant after selective flap elevation. So as I said, I will fix this surgical guide template with the 3 anchor pin. So when fixing the surgical guide template with anchor pin, the sequence is the most important. To prevent the tilting of the surgical guide template, the midline anchor will be used for the first time. This is a drill for the anchor system. 할게요. About two-thirds or 3/4 installation is recommended for the even fixation with the anchor pin.
Okay, Dr. Osstem, I would like to ask you, I understand that you have used variety of guide systems. What do you think is the advantage of OneGuide system compared to a conventional guide system?
Leadership is papered multi-step design.
Yeah.
Like inserted very well.
And for the even tightening, I will use a mount extension, middle side, anchor pin. In this way, we can minimize the possibility of the surgical guide tilting. Okay. Additional tightening in the middle side, midline area. So this is the initial drill. initial drill is most important to guide the next drill. Irrigation. And depth control. Yeah. This is the end of the implant placement. Up and down motion is most important to remove this bone debris. Irrigation.
Ensure that the template is placed in micro.
So
There is the Osstem OneGuide system. You can
So this is a 3.5 OneGuide drill. And second premolar area, I place 4.0 by 8.5. And
he designed the circle template. Can you see the lower left side on the template is there? W. Then you see the winding like 5.0. And better discrepancy, so that we can cover the
so this is a flattening drill to flatten the crestal irregular alveolar bone. Yeah, after flattening the crestal area, the OneGuide drill can touch the top of the surgical template. Yeah, this is a flattening drill. Yeah, I can touch. This is a flattening drill. A 10mm OneGuide drill. 뭐 그려라.
and use the teach brush. You can see the very clear area. The template is going to move on to the right side. So what is target posture? You know that?
This is, 멘티라 좀 힘드실 겁니다. 땡겨. 예.
How about the
그치? Hex positioning and depth control was done successfully.
Well, he's planning immediate loading after the surgery.
Premolar implant in the right side, 4.0 by 8.5 millimeter length. (4.0) by 11.5. 조금만 마치. 물 끓. So let's remove the surgical template, irrigation. Remove.
The guy is pain is very difficult to get popular with.
한 번만 도와주세요. 크게. Is it less than? Yeah. Penetration or not? Not penetrated. Okay.
Normally the important one is trying to be under preparation, the final release.
아프세요? 맞춰줘.
The side can. And then he got the very good.
I usually use a 1 millimeter longer stopper than cast drill to check the sinus flow penetration. Go to the depth gauge. millimeter.
Much more than we expected usually. And actually said in such a condition, yes, it can.
Yeah. The medial, because of the inclined plane, so the saline comes through the first original drilling site.
He needs to do very well. It is a piece of cake with the pencil.
Three to 4 millimeter. So laser marking of the fixer driver. Initial stability is quite good. I make an incision.
The true honey, just just to show us the
긴 거. Yeah, so I will connect only left side. 작은. Let's see. Bye. 물어보세요.
yeah. Okay. Another question.
按照这个意识的这个临时胸部肌的来
Doctor, please answer your question. My question is, when we have or not have adjustment.
You mean your question is when we do the immediate loading, we choose text right? And the plan and the installation, the use.
옛날 버전 힐링 주사.
마취 좀 더 준비해주고.
아이들도 해야 돼. 그래서 골라보고 해야 돼.
아프세요? 마취 더 줘.
아프시면 소리 내세요.